start recording at this point. So good morning. You are with the statewide CDSMP collaborative monthly meetings for February 5th, 2015. And I think we'll go around and do somewhat of a roll call / introduction. And I'm going to look at this list and acknowledge everyone as we go down. Sue Conry, are you here? All right, let me move. She's probably stepped away. Meredith Koo?
Hello.
Good morning, Meredith, from your car.
Yes.
Crystal Ryder?
Yes, good morning.
Crystal, are you online?
Yes, can you hear me?
Yes, thank you. Okay. Samantha Decker?
I'm here.
Good morning.
Good morning.
And then we have Kelly McCracken here.
Yes, I'm here.
Thank you. Kanika Ship?
Oh, shit. I'm here. Morning.
Good morning. Connie Young?
Here.
Morning. Sue Conry, are you there?
Yes, I am. I'm here.
Okay, sorry we missed you. Ellen?
I'm here.
Hillstrom?
Can you
Good
hear me?
morning.
No. Good morning.
Yes, we hear you. Good. Who else? Oh, Greg Smith.
Yep.
Okay. Good. And did Monica Wolf just join us?
I did. Good morning.
Good morning, Monica. Is there anyone we might have missed? All righty then. Well, great. Welcome. And I think we all know each other out of this list. Don't think yet we have any newcomers. And then also here at COA, it's myself, Mary Pat Gallus, as well as Lindsay McIntosh, and Cheryl Wakefield is with us. So we're glad to see you guys all here on a warm, sunny February morning after our snow yesterday. Okay, so we'll just start moving down the agenda. Looks like maybe Susanna, did you just join us? Susanna? No? Yes, she says. Okay, she's with us too. She may not have audio. Okay, thank you. All right, so I'm going to let Kelly McCracken start with our next agenda item, talking about our data submission and data entry. So Kelly, if you want to chime in.
Sure. Thank you so much. And I just want to check, I have a headset on. Is my volume okay? Can folks hear me?
I'm good.
All right.
Yes.
All right. So thanks, everybody, for having me on the agenda. As you know, Flora Martinez moved off of this project, and so I've always been a part of it, and now I'm coming back on in a more sort of present way and being a part of these CDSMP collaborative calls. As you know, that we have been collecting data at the state. You all have been great about sending that data in, and Lori Scott, one of our administrative assistants, been entering it. And it came to our attention about a week ago when we got some requests for host organization or license holder specific data that there have been some misentries in terms of who the license holder is associated with a site that's implementing the program. And so I've worked with Lori to kind of understand the problem, and I think we have a good solution for it. So this kind of report out is twofold. One, I want to just explain how things have been entered and how we're going to fix that. And then the second thing is to talk a little bit about what this report can look like that's specific for a license holder. We're trying to get a better understanding with NCOA about that database's capabilities around these reports. They're not fantastic capabilities, but they do have some. There is some way that you can report out on just a specific license holder. So I'll start with the workshop information cover sheet, which is how this information, comes to us, that we're able to connect site name, which is where the class took place, with the name of an organization licensed to offer the program. So I think everybody's familiar with this sheet, and your lay leaders are filling it out. And I have a feeling maybe this is where some of this started, is that often when the name of the organization licensed to offer the program, sometimes that's filled in incorrectly. A leader might put the same site name, so they might be offering it, for example, at the Longmont YMCA, and then they'll put that for the site name and the address and all of that, and then they'll also write that same Longmont YMCA for the name of the organization licensed to offer the program instead of writing COA, for example. And so in the NCOA database, when Lori enters this, she tends to go back to what has been given to her in the past. And so if that's been traditionally how these come in, she'll put in Longmont as the site name, and she'll also put in Longmont as the name of the organization licensed to offer the program. And so I guess my first request is that, you know, maybe have a conversation with your leaders about making sure they're doing their best to put in the actual license holder in that number 2. That would help Lori out tremendously. And then what we've done on our end is this has always been a part of our quality assurance checks, but what Lori's done is she's actually corrected the sheet so that it kind of matches what she already has in the NCOA database. And so when folks have been doing the quality assurance checks, they've been going with what Lori has written on there, what has been written on there, and thought that it was okay and didn't realize that it wasn't connected to the right license holder. So we're all on the same page with that now internally. The person checking the quality assurance has got the list of license holders. Lori's aware of the list of license holders, and we're going to work with NCOA to make sure that in the database all of the license holders are mapped to those site names, because that's an additional step where we have to call NCOA and let them know, okay, this particular site needs to have a drop-down where this license holder is an available choice for that site. So there's some steps here, but we are going to be taking those steps. And then Lori's done a great job of keeping track on an Excel spreadsheet of all the data folks have sent in, and she's written down the site name and the license holder. And so what we're going to do after this call is send that out to all the license holders so that you can go through it and correct if a site that's a class has been offered at isn't connected to the correct license holder. So for example, COA might see Longmont YMCA connected to Longmont YMCA. Well, they know, and we know, Longmont YMCA is not a license holder, so they would correct that to say COA. And then we'll go back and make those corrections in the database, working with NCOA to make sure we have the right license holders mapped to the sites. Are there any questions about that? That's a lot of information to throw at you. I do want to assure everybody that all of the information has been entered correctly in the database in terms of statewide numbers. We've got that, and that's how you all have been paid, because we enter it, and then Central Colorado AHEC knows that the data came to us, and then they issue you the payment. It's just a matter of how those sites and where those classes took place, which license holder they're connected to. And so again, after the call, I'll send this spreadsheet to Mary Pat, and then maybe she can send it out with the minutes, and folks can just, license holders can send it back with the corrected license holder next to the site name that the class took place at. Any questions
Kelly?
about those steps? Yes.
Hey, it's Connie. Hey, I was just wondering if you thought it might be helpful on the aside from the spreadsheet that looks backward, on the forms that people fill out all the time, whether it be helpful for people to have you like send something out and with a circle and, you know, around the fields that you're that we're wanting them to fill out differently, and maybe some basic instructions, especially people who aren't on the phone and we don't have the forms right in front of us right now to
Sure.
look at.
Yeah, I can definitely send out that worksheet information cover sheet, and I'll highlight number 1, site name, and number 2, name of organization licensed to offer the program. And again, really the instructions are simple, just to maybe have a conversation with your lay leaders to make sure when they're filling out number 2 that they are filling out the actual license holder, not just repeating the site name where that class took place. So that's a great suggestion, Connie. I'll highlight that on the worksheet information cover sheet. And maybe Mary Pat, if I could ask you to send that along with the minutes and the spreadsheet that I mentioned where the corrections can get made.
Absolutely.
Are there any
And
other questions about this?
Sorry, Connie had one more thought. Just when you and I were looking at the spreadsheets, it seemed like also sometimes people were confused on, I mean, maybe they don't know what the name of the license holder is, because it would say, like, Rural Solutions was the, I'm sorry, I don't have the spreadsheet in front of me, but was the provider. What's the first column, the name of the first column, Kelly? It's not provider, it's...
Let's
Are you
see,
still
it's,
there? Okay, well,
host
anyway,
organization.
host
and
organization would
yeah,
say...
and I just want to,
then,
oh, I'm sorry, Connie. I just wanted to let folks know that host organization is synonymous with license holder. So in the NCOA database, these are entered under a column or a field called host organization, but it means license holder. So, okay, go ahead, Connie.
Yeah, too bad they don't just have that, so it would make it easier for all of us. But yeah, with like host organization saying something like Rural Solutions, and then the site saying, you know, community church. So it's easily understood why people wouldn't know what they're supposed to put in there, but it could be two different things that were in there, and the license holder was not correct, as Kelly's explaining.
Yeah, this is Mary Pat from COA. I would agree. I think that line did present some confusion, certainly with some of our partners, and I'm really glad, Kelly, you brought it to our attention, so we can double check that as we get that paperwork, because it obviously goes through us before it goes out to the state, and so that's been a good lesson learned.
Yeah, and a good lesson learned for us, too. And I want to apologize if this mistake was made. However, I want to assure everybody I think this is an easily fixed mistake, and that when host organizations or license holders, so I'm using those terms synonymously as well, you know, ask for this data to be specific to their license or to their organization, then we can present. Third thing I'm going to send to Mary Pat. Mary Pat, I hope this is okay. I didn't ask you about this beforehand.
Yeah, I've got it on a group mail, no problem.
All right. Lori got kind of a printout of what the different NCOA report options are from NCOA, and she's highlighted the one that she thinks would be the most helpful to host organizations or license holders, and that's the core demographic report. And this is a report that basically runs through all the demographic information about your participants that took your classes at your organization. So this could be helpful for you in writing, you know, reports for your organization or presenting to leadership or whatever it may be. It also compares it to our state data, and it compares it to the country's data. And so you kind of see right away where your organization might stand in relationship to the state and then to the country. The report is not super user-friendly. I'm not going to lie. It kind of comes out in this funky way. I'm not thrilled with the capabilities of this database, to be honest with you, but we're continuing to ask these questions to NCOA to see if there's any way this can be done maybe a little bit differently. I can't promise anything, but you can understand the report. It just isn't the most elegant looking report in the world. So I'll send out the different reports and with that core demographics report highlighted so you can take a look at what you could expect. And then I can also send out an example of what that report looks like on a PDF. And so I can do that too. In fact, I think, Mary Pat, you've got one for COA. I know it's not correct, but that could be, if you wouldn't mind just attaching that as well. I'll get you all this stuff. Then folks can just at least see an example of what that looks like. And
that was maybe about 3 pages?
About 3 pages.
Yeah. Okay.
Yeah.
Yeah, it's really interesting information to have.
Yeah, I think it is interesting information. It's just, like I said, it's not as elegant as maybe I would like to see it, but it is available. So all that stuff will be coming. So I'll send out the worksheet information cover sheet with the 2 places highlighted that we need folks to pay attention to. We'll send you a copy of what that report looks like, a copy of all the report options with the core demographics highlighted, and then the spreadsheet of what Lori's been entering, so your organization can correct and let us know who the correct license holder is attached to that implementation site. So those are the 4 things that will be coming out with the minutes. Any questions about any of that?
Hey, Kelly, it's Lindsay. I just want to say thank you for all your work on this, and thank you, too, to Lori. Please let her know we appreciate her.
Oh, I will. That's so nice of you. I know. She felt so badly about this, and I said, no, this is all fixable. And she's so conscientious, and she really does do a great job getting all this stuff in. And so she wants to make this right too. So thank you for that, Lindsay.
Oh, sure. We totally get that, and we see now the piece of it that's ours to do too. So absolutely, we're all gonna step it up. And in the light of a good chronic disease self-management training, that's problem solving.
Yeah, so that's right.
We see these issues and we just problem solve them. There you go. But if you want to go ahead, Kelly, on that next item about license holder MOUs.
Definitely. So in the past, back when we held the R grant at the very end, CDPHE issued a number of memorandums of understanding with several license holders in our state that basically laid out opportunity that if data was sent to the state to be entered in the NCOA database, we were able to provide materials for your classes that you taught. When Connie's group, the State Union on Aging, took on the grant starting a couple of years ago, we communicated very heavily about the fact that that material was going to be going away once it was completely used up, and that the reimbursement that was received by license holders for their classes contained, that amount contained for the materials as well. There was money in there for materials. And so you might remember there was a lot of conversation about that a few years ago. This MOU situation came up again because we got a call from a license holder whose legal said, this MOU is about to end because the end date on it is March 31st of 2015, and she wanted to know, are we going to re-up this MOU? And so I just had a quick conversation with her explaining that now that the grant is held by State Union on Aging, where the reimbursement fee includes a fee, amount for materials, there's no longer a need for this to be in place, and we will not be re-upping these MOUs. And so I just wanted to announce that to everyone, and then also to answer any questions you might have about that. Any questions? So I guess just be prepared that if you had held an MOU with CDPHE, that was this sort of data for material type of relationship, that your legal may ask you about it because, again, the date is March 31st of 2015 is the end date. And if they have any questions, or if you have any questions, if that happens, you can always reach out to me and I can talk directly with them or you about it. But I just wanted to put that out to everybody that we will not be re-upping these MOUs.
All right. Well, if there aren't any other questions on that, we will move right along. Thank you so much, Kelly.
Yeah, thanks, everyone, for your time.
You bet. So our next item brings us to Connie. We know Lindsay Blackwelder is not able to make this call. I have a couple comments from her, but let's let Connie go ahead and update us on year 3 grant. Year 3 of the grant.
Okay. Thank you. Let's see. I have in the budget for this year, as a reminder, I think most of you, maybe all of you know, I have some money in there for lay leader training and master trainer training. And I did send out that query to everybody several months back when I was finalizing the budget to see what your needs are. And I'm going to be in touch with you over the next couple weeks to make sure that's still what you're looking for so that I can figure out what we can do. So just wanted to let you know that. And also a reminder that in our contract with COA, we also have some scholarships to pay at least part of the cost of someone attending their lay leader training. So if you have, as COA talks about their upcoming training sessions that they have, if that looks like something that you would want to plug one of your prospective leaders into, and if you need support for that, then we have an application, basically scholarship application, basically trying to make sure that whoever we pay for has a high likelihood of actually leading classes, so we're not just paying for something that obviously doesn't happen. But I'll be in touch with you about that so we can make some plans for that. I did find out, or let's see, any questions about that?
Connie, this is Mary Pat. I just had a quick question. We obviously have a Commando controls training coming up, and CCHN is paying for the cost of that training. So we've opened it up, statewide, and really done a lot of recruiting, especially to our community health centers. And I think you mentioned this last time, but I wanted to get clarification on if there might be funds available for travel and or lodging for folks coming in for that training. It will be held here in Denver in March, end of March. So their cost of their training is already free?
Yeah. Okay. Yeah, I gotcha. I do think that that's a possibility. I didn't write it up exactly like that. I don't.
Oh,
well,
okay.
Actually, I think it was probably general enough that I think that would be a legitimate way of using some of that funding. So let's talk about that and what the needs are, and
Okay.
yeah, because I think that's, it's in the same vein, and we, I think it was like scholarship support for the classes. So I think that we could probably do that. So yeah, let's talk about that and see what your needs are. And I also wondered if Susanna is still on the call.
Yes.
Yes.
But she doesn't have audio. So
Audio. Oh, okay.
She can respond by email real quick.
Okay, gotcha. So anyway, just to make sure that Susanna knows that that class is available, and if she has any people that she would like to get trained, then to talk
she's
with
already committed to 2.
Oh, good. Okay.
Yeah, and she says thanks, Connie.
Okay.
She responded last month right away when we started talking about it, and we have reached out to license holders and clinics that we think, and particularly in the areas, Monica's group is going to send 1 or 2, et cetera, et cetera. So we really feel like it's going to reach out into our state, especially into some of our smaller rural areas. But that little caveat comes up about the expense. We also, as we are talking to folks, asking them to commit to maybe see if it can be any kind of a match, of a commitment, so to speak, in those costs. And just kind of feeling that out as well. And then, as you mentioned too, just a commitment to teaching classes after the training.
Yes, exactly. Okay, great. Anything else? Any other questions?
Hi, this is Glenda Mitchell. I wanted to ask, because I know quite often the monies are not available for programs such as the one we offer, which is only the diabetes self-management program. We don't do the chronic disease self-management program. So can we make those clarifications when we're talking about this kind of stuff?
Well, yeah, and thanks. I do tend to just refer to CDSMP in general, but absolutely, if you if there's a need for training and we can afford to we are looking at where we can put the money, and I'm sure there are probably more demands than we have funds, but I would be more than happy to talk to you about that. There's definitely no exclusion, and definitely support what you're doing with the DSMP. So were you thinking leader training? Or
right, Yes, definitely leader training.
Yeah, let's give me a call afterwards or send me an email about what you think your needs are, Glenda, and then we'll put our heads together and see what's possible.
Okay, and that's for a scholarship.
Yes, well, any of the above, really. So if you wanted to apply for a scholarship or a partial scholarship, at least for someone to go to COA's training, that would definitely be a possibility. If I know you do your leader training, you have your own staff for that, right? When you do it internally.
I'm not sure I understand your question.
You have master trainers at the center that do some of your leader training, is that right?
We have one master trainer, and so the problem is that we'd have to bring a second master trainer. There's expense there. And so if there's a way to send someone to a class that's training DSMP leaders, that's an option is what I'm referring to, as well as scholarship money to get a master trainer out here, whatever that would be.
Yes, there is a scholarship training to go to COA. I mean, scholarship funds to go to attend COA's training. And then I also have a small amount of funding to support organizations that are doing some of their own training. So that is a possibility to support the fees of having another master trainer join your master trainer to do training for your people. So it would kind of depend on what the best use of the funds is, how many people you need to train, that kind of thing. But let's chat afterward and we can figure that out. Does that sound good?
Oh, all right. Thank you.
Yeah, thanks for bringing it up. I'm glad you did, because it's definitely, and when we have supported actually some of the other training, like with Monica's group last year, we paid for part of the cost of her leader training because she's so far away and has so many classes going and I need for leaders. So she had the trainers do the CDSMP and a DSMP class afterwards. So any other questions on that?
Can I just add something?
Sure. Yes, of course.
Great. I just wanted to mention to Glenda and everybody else, when we talk about the chronic disease group, it includes the chronic disease self-management, the diabetes self-management, the Spanish version Tomando diabetes, and the Tomando chronic disease, and also the cancer thriving and surviving, the chronic pain, the HIV program. And so all of those are in that whole chronic disease group. So, and then within the state, we do have master trainers in diabetes that are here in the metro area. So we tend to share amongst all the license holders. We need somebody to master training. So Glenda, if you are ever in the position that you need master trainer in diabetes to help, let us know, because there are a few of them in the metro area that I know would be happy to work with you.
Thank you.
Lindsay and Mary Pat.
Yeah.
This is Meredith from Telegen, and I would just add that there's a possibility that we'll also have funding to support you all sending folks through DSMP training. So you might keep that in mind and reach out to us to see if you're in an area where we could justify supporting some help in that area as well.
Yay.
That's great. Hey, thanks for it, Meredith. Do you know when you might know about whether you have any funds or not?
No, it will be based basically on the penetration of Medicare beneficiaries in the area. So we'll really need to look at each case at a time as it comes up. But I can start proposing that really at any time with our leadership. So,
oh, great.
Yeah, if there's a need, let me know.
Connie.
That's great.
Hi, Connie. This is Monica. And I was just going to put out there, too, that here at South Central, I I'm also a master trainer, and so I'd be willing to kind of go around wherever needed to help out also. So just thought I'd throw that out there. So, and that's in both, of course, chronic disease as well as diabetes. So if anybody needs anybody else, will just keep me in mind too.
So there wouldn't be a leader or a trainer fee for that, since you're doing it as part of your job, or is that just to clarify?
Well, you know, if I travel
or
out of
not
town
sure.
and stuff like that, there would be somewhat, but it
for
probably
travel,
would,
yeah.
Yeah. So for traveling.
And we could look at supporting some of that travel too, since it's kind of along this, all in the same vein. So
yeah.
Lots of options, it sounds like. So that's great. I'm glad you mentioned that too.
Okay.
Anything else? Okay. Kind of along the lines of training, Lindsay McIntosh just mentioned this a few times, but just to touch base on it a little bit. We've got last year, Lindsay and Mary Pat and I did a couple presentations to some of the area agencies. Well, one area agency on aging was Dr. Cog, which we talked about before, the one in Denver. And then we did this out in the Grand Junction area with a variety of organizations that Sue Connery helped us organize. I do have some funding in our budget for this year to do more of those. And the initial idea was to focus on the area agencies on aging, and that is still an important goal. But we can look at doing those. The idea of doing these presentations is to basically get referrals, and then maybe also recruit people who might want to become trained or leaders. So I think we can broaden that to different organizations wherever we might have a chance to have a good impact, whether that's focused on one organization that happens to have lots of people who would refer or be in the position of referring, or if we do it in a community where we invite a variety of organizations to come. So including, you know, like the senior organizations, vocational rehabilitation, the AAA, Alzheimer's Association if there's an office, senior centers if I didn't already say that, and hospitals, clinics, etc. So if you all could think about that, if you think that there might be an opportunity or need in your area for something like that, give us a call. Give me a call and let me know, or send me an email about what your thoughts are, because we want to offer these, and we're assuming they're helpful and beneficial in spreading the word to some of the key referral sources. So we'd like to hear from you and make good use of those funds for this year. Any questions about that? Good.
Monica, and I don't get those very often.
Oh, yeah, right.
And Monica can chime in on this one. We recently had conversation with Valleywide Health System, which obviously is home-based in Alamosa, actually, but we work with them more in their La Junta clinic. So they have multiple clinic sites, and we started a conversation with them about sending some staff to the Tamando training, since they deal a lot with Latino population. But anyway, one of the things they commented and asked for was something like you're talking about. It's been quite a while ago that Lindsay had opportunity to go down and speak to their staff and do a presentation, and they made reference to that and said, we've had turnover, we have new people, could you consider doing something like that again? So that's a possibility, and then they of course work with Monica in Alamosa and so forth in her area, and we work with them, you know, so it's kind of a multi-crossover type of an approach, and I think they would be very interested and already expressed interest.
So like a whole Alamosa piece, Valleywide.
Yeah, invite
like
Valleywide
and
we could do it with the Valley Girl on the phone.
Yeah.
Yeah. And that's for Tamando Control.
Well, no, it was for the whole thing. Like,
Oh,
you know,
the whole thing. Okay.
Explain chronic disease self-management, explain how you do referrals, explain messaging for staff was the presentation. But it would be for any one of the curriculums that Valleywide might integrate, whether it's chronic disease in Alamosa or Commando or diabetes in La Junta, doesn't matter. And I think they would be very interested and would pull together their staff to do that.
Yeah.
So there's a thought.
Yeah, and we have, we've met with the medical staff, and we also, what I am is I've, in contact with Nora
Right.
by email, and, we have had some referrals from them here in the last month or two in regards to diabetes or chronic disease, which is good. And I know that we were kind of talking, and this is something I need to get together with Nora about, but, they're the ones that I'd like to see, or some of them, go up to the Tomato control training, because we've had some interest from some of the girls up in the center area, for those of you that kind of know the Valley. So yeah, we're really working with them, and hopefully even if we can get 2 or 3 up from Valley-wide anyway, as far as Tomato goes, and then get that going too, because we have had some referrals in regards to diabetes, so that's really good.
So if we approached it from working with the AAA, Monica and Connie, what we could do is not only include the Valley-wide, but also include the other hospital system down there, as well as including maybe even some of the other programs in the area. Like I think there's a Live Well still has something going, and there's some other services down there. So we could do kind of like what we did in Grand Junction, where we invite people from a lot of different community groups to just kind of all come together and talk about it.
Yeah, that would be awesome.
Yep. Oh, okay, great. So location-wise, it would be, where would we be doing it? Look, Alamosa? No.
That would be my guess. Yeah. That's kind of their hub, isn't it, Monica?
Yeah.
Okay.
It's a big city.
Okay, yeah, let's talk about that. That sounds like a great idea.
Okay.
Anyone else off the top of your head think you might want to touch base about that? Again, it's like what we did was a half-day training and presentation for professional staff that would be in the position of making referrals or becoming leaders. So we could probably tailor that a bit, shorten it some if needed, but that was the intent. So if you have if anyone has some ideas, or you can shoot me those later, unless anyone was starting to talk just now.
Yeah, this is Crystal. Monica, at one of your last trainings, did you have anybody from Conejos County Hospital attend?
No.
No? Okay. I know at one point, because with one of the programs that we work on, which is ending in June, we work with Conejos County Hospital and La Junta Medical Clinic, and the hospital had some interest that they didn't want to travel up to Pueblo, and so
okay.
Well, I just wasn't sure. So maybe we can talk offline too. I don't want to take too much time on the call, but
okay. Yeah, I'll get back in touch with you because I have some other thoughts too about another training. So yeah, I'll get in touch with you, Crystal.
Oh, okay, sounds good.
Okay, great. Just briefly, every year we seem to be unable to spend all of our money because we, partly anyway, because we get started late for various reasons with a contract and MOU. So I'll be putting in the request now for spending the money that we didn't spend in year 2, and putting in a request to be able to spend the rest of that this year. There's really not any change from what we had last year. We had, it's basically on the completers that for all of you that have MOUs with AHAC to do classes, it would be putting back in approximately 57 completers that were in year 2 contract that weren't reached, and then just continuing COA's contract. So, but Lindsay Blackwelder will know about that when that happens. I don't expect it. It won't be anytime soon, but I don't know exactly what to predict since my prediction skills were a little bit off last year. It'll be at least a couple months from now, but just wanted to let you know that. And then the last thing on as far as the grant or the year 3 grant goes is that I did find out that there is money for another year of the grant from the Administration on Aging and Administration on Community Living. But I don't know if that means anything to us or not. Right now, I don't have any information other than that they did succeed at getting some additional funding, but I don't know what that's going to look like. I don't know if they'll, I really don't know anything, so it could mean that the money goes to other states or just certain states or certain projects or whatever. I don't know if we would have time to, enough lead time to submit a proposal if that's needed. So lots of things, or pretty much everything is up in the air other than the fact that there is a possibility of having funding beyond August 31st. But for my purposes, I'm planning on that there isn't, just because that's the safest bet. But I just wanted to give you an update on that. And that is everything I have on the grant.
I'm just going to quickly, Lindsay Blackwelder's comments, but right along what you just said, Connie, she just said to remind him. Now she has quoted 62 completers might be added. I don't know if that's
Yeah, okay. Since she said that, yeah, there's some money that they didn't spend in certain categories of AHIC's budget, like for conference calls and things. So I told Lindsay if she wanted to free that up, we could put it into completers. So it sounds like she wants to do that. So yes, that would be.
Yeah, she's definitely reiterating what you are saying, and that probably mid-April revised MOUs.
I'm not going to say
right
probably to anything. I don't think they probably.
Sorry.
It hasn't even gone to. I'm waiting for some information before I can submit it
so that
to
might
the
be
federal level. That was my
prediction there.
Well,
and then just to
I
remind
told her,
folks, because I know a couple of us ran into this last year, that if you get an extension of more completers added to your number, that those folks are not effective, those classes, until there's a signed MOU. So like you said, if it's not mid-April and it ends up being late April or early May, it has to be classes that start after that signed date. Just a reminder.
And I'm sure when I was talking with Lindsay, you know, I was saying I would hope by mid-April, but I'm not going to say probably, because there's a process at the federal level where, you know, they have very specific needs for describing certain funds and where certain funds are reflected, and I don't have any instructions exactly about what those are ahead of time. So yeah, I have to revise.
It could take longer than we'd like it to, right?
It always does, you know, and then it has to go through a few hands in the federal level and several hands at the state level. So,
well, that's good for all of us to just be aware of, because then we don't lose. I mean, if people are expecting that they're going to get 10 more reimbursements, they got to make sure that that class is occurring after that signed MOU, and we're not exactly sure what that date is yet.
Yeah, but it would really be pointless for it to not be before the beginning of summer. Otherwise, you know, don't have time to do them. And
crunch time. Okay.
Yeah, I know.
So we'll just all stay tuned.
Okay.
Together. Yeah. So go ahead on your sustainability planning.
Okay. Just a few things. Wendy is drafting the plan, and once she has that, she'll send it to me, and we'll work together on finalizing that and clarifying things and talking about next steps. I'm hoping that we can do a conference call with her after that, so that she could go over some of that and have some discussion on the phone. But I wasn't able to confirm that with her before our call today, but I would be shooting for that. You know, for those of you who were either not at the end of our in-person meeting or weren't there, we talked about a lot of good things. I think it was, from the feedback I got, it was really helpful. And we talked about a lot of big picture things and needs and approaches. And one of those at the end was how would we sort of champion this cause? and lead the cause, especially after grant funding goes away. And we talked about a couple different options that were recommended by the group, and to have one organization like sort of marshal that, but I'm guessing that there'd be, at least personally, I'm hoping there'd be involvement from some of all of you just for your technical expertise and support and all of that. But anyway, whoops, I heard a beep. Am I still on?
Oh, yeah, I'm on. Yep.
Thought you may have disconnected me.
No. Unless it's just us and you. Is anybody else?
Yeah, is everybody else still on?
Looks like
It looks like we're all still connected.
Here.
Okay, not sure what that was. So anyway, I don't, Koa, I don't know if you actually raised your hand as being interested in that, but I'm just assuming that you would be. Is that
We definitely are, Connie.
okay? Great. And then Lindsay Blackwolder from AHEC said she would talk with her central office to see if they were also interested as another candidate. So she was going to be talking with them this week. So I don't know when she'll know for sure about that, but that would be something we would be, talking about in the future to figure out how we do all this. One question I had though is, one of the pots of money that is available now through Medicare is for diabetes self-management training. It's similar to the DSMP, but has other medical requirements attached to it. We tried to get something like that going in Grand Junction, and we're not successful, but that was a goal of this grant, and it does offer a fair amount of funding for classes, and that would help sustain the diabetes classes to the extent that some of you want to, meet the criteria that are in place to provide those classes. And I don't want to go into all the details about that now, nor would I probably do a very good job of covering everything, but I wondered if that's something that we might want to put as a priority for pursuing funding, because it is available now. There's lots of people that have diabetes, lots of effort to do diabetes-related kinds of work, so there seems to be a lot of focus on that. And other states have succeeded at doing it, and there's information about how they've done that, and there's ways of connecting with them online to see what some of their obstacles were, how they overcame them, that kind of thing. There's webinars, some of which I've sent to you all before. Anyway, I just wondered if that's something that some of you on the line would want to maybe work as a small group on, looking at how to pursue that, where whether we can, what like I said, what some of the challenges are, how to overcome those, what's needed, all of that kind of thing. And I know that let's see, we don't have Emily from American Diabetes Association, but I think she had mentioned some interest in that as well. What do you all think about putting some effort into looking into that possibility?
This is Monica. I think that would be awesome. And would that be like sustainability for funding for the classes, or for those?
Yeah, if you do the diabetes, you have to do, it's a diabetes self-management training, which is it's different from DSMP, and there needs for, I think you need to do it through Medicare or connect with a Medicare provider, and there's some requirements as far as who's leading, and I don't want to misspeak on this. I haven't become an expert on it. Lindsay, can you add anything to based on your knowledge of what's required?
Yeah, if you're talking about
let me, I'm sorry, Monica. We're all talking at once. Well, I was going to mention, Monica's question was about funding, and then I want to come back to what I just asked you. Sorry for jumping around a little bit, but Monica had asked about whether it would fund classes. Medicare, it would be billable Medicare service. So for people who have Medicare who take the, I'm getting an echo here. Sorry, I don't know what that's about, but people who you provide the DSMP, diabetes self-management training to, then you could bill Medicare for that, and you'd be paid for the classes that they attend. And you know, it's not $20 a class; it's a lot more than that. But it does come with the requirements. And so yes, it would go to sustainability of diabetes self-management training, which is slightly different from DSMP. And then I was just wondering if Lindsay McIntosh has, off the top of her head, some more of the requirements that are needed for DSMP that you could list.
Okay. It's a process to be approved to have Medicare's approval to do this. You have to get approval not only through Medicare, but approval through either the American Association of Diabetes Educators or the American Diabetes Education group. So either the AADE or the ADA have to approve it, as well as Medicare. And the program is designed to reimburse for diabetes education, and so there are a limited number of contact hours that are paid through Medicare as a benefit. So if you are approved, your program is approved to do this, which is in and of itself requires some changes, then if the person in your class has not already used up their benefit for diabetes education, it can be billed and reimbursed. But what we've discovered is there's some big ifs there. And so the majority of the programs that have been working on this, it's taken them the shortest period of time I've ever heard with somebody who did it in about a year. For other programs, they've been working with it for several years to be able to get the pieces and parts in place. It requires documentation and work with medical practices because you need to get pre and post evaluations that are medical evaluations. You have to have a diabetes educator either on site or very close by. We were able, in a rural situation, to talk with a practice about the possibility of teleconnecting a person, a certified diabetes educator, to be on call throughout the classes. And then the class sections itself, the class itself runs like a diabetes self-management program, but there is a clinical piece at the beginning and a clinical piece at the back end, which involves having a medical professional sign off on a treatment plan for the patient. So it's a little bit more than just than the class and the paperwork. But all of that information on how you're going to do that, who's going to do it, how the curriculum works, all of that has to be submitted not only to Medicare, but has to be submitted to either ADA or AADE for their approval before you start collecting. And then the reimbursement itself is based on the contact hours available to that particular individual. So if there are 20 hours of diabetes education allowed in the first year after diagnosis, and I've already worked with a diabetes educator, I may have used up all of that time and then want to do a self-management class, in which case there's no reimbursement connected. On the other, and where the pushback comes from is that if there's a set number of hours, and I'm saying 20, but I'm not sure that's still an accurate number, if there's a set number of hours, traditionally a diabetes educator wants to do that 20 hours so they can bill that time because that's how they get paid. So what we are asking them to do is to not bill for their services, but to refer a patient so that they can be, so we can be reimbursed, or whoever can be reimbursed for that education rather than working directly with the CDE. And so that's where some of the pushback comes. In theory, they're very different kinds of, a self-management program is very different than a medical clinical treatment for diabetes with a diabetes educator. So they are oranges and apples, but it's oranges and apples going for the same dollar. And that's a really quick overview.
Lindsay, this is Linda Mitchell. Can I ask a question? Just to clarify a couple of things I think I heard. So if the, basically I think you were saying it took almost over a year to go through the process of getting this approved once an organization said they wanted to do this. Is that correct?
That's what I have heard from the organizations that I know of that have gone through the process, yes. That it can be time-consuming. Yeah.
Time-consuming. And then I understand perhaps that when you're dealing with Medicare, do you know anything about the turnaround time for reimbursement? Because a lot of times it's typically very slow. Have you heard anything about that?
You know, I haven't, because the folks that I know of that have had success doing this are working in conjunction with a health entity that already has the Medicare number. So they have a little bit more flexibility and probably more, it's not as obvious a cash flow timeline as it would be if one of us as an individual organization went to get a Medicare provider number.
Right.
But the payoff is much more than the grant. And of course, I was just looking at a fact sheet from NCOA about this, and it says that 28% of Medicare beneficiaries have a diagnosis of diabetes, yet the American Association of Diabetes Educators estimates that only 1.5% of eligible Medicare beneficiaries have used their DSMP benefits. So there's no shortage of people who would be candidates for this class.
Okay, I don't want to leave Monica hanging out there because she did say she was interested. So I'm interested, but I would have to talk to my executive director first to see if that's something he's interested in, because I can't move without his buy-in on stuff. So I'll do that, and then let you all know.
He may not have enough.
I totally agree with Connie that there are no shortage of people that have that diagnosis. The problem that we found was that it's not only about finding the people with the diagnosis, but it's finding the people with the diagnosis that have buy-in from the medical folks that will refer them to the class and not see it as a point of contention. Because what we have found with our limited amount of experience is that a health system would rather keep people on the waiting list for a certified diabetes educator so that they keep the dollars in-house than they would refer them to a program for diabetes self-management and lose the reimbursement dollars. But I agree with you. The numbers are definitely there.
So, Lindsay, it sounds like COA is not interested. Is that what I'm hearing?
Yeah. I think that what we are more focused on would be working with the chronic disease program with health systems and also eventually diabetes prevention program.
So I guess the question would be for other people, if this is something you might be interested in, we could have a separate group that looks into this and goes through. I think what would help is to go through the webinars about this, because there's a lot of really good information that's already available, and I can send you the links to those again and to this basic fact sheet and some of the materials I have. And then maybe I'll send an email out to people so everybody gets a chance to respond, and the people who might be interested in looking into this, not necessarily committing that you definitely want to do it, because I don't think anybody has enough information yet about what the requirements are and how much time it would take and all of that, as well as the payoff. And then, but then we could see if we want to, put together a work group on that. Does that sound good?
Sounds great. That sounds good. This is Mary Pat again, just to kind of move us along. But I think your idea of doing this as a subgroup offline sounds like a really good idea. Glenda Mitchell's expressed interest, Monica's expressed interest. There could be others who would be interested in forming a little subcommittee, so to speak, and investigating that. That sounds good?
Mary Pat?
Okay.
Yeah. Yeah.
So this is Meredith, and I won't take a lot of time, but given that we're contracted with Medicare for everybody with diabetes counts, this takes some of that into consideration because we have resources to help folks build those clinical programs if they're interested, but also know that Medicare definitely recognizes the benefit of these community-based DSME programs, and part of what they're tasking us with is getting data into them so that they can start to look at those outcomes over time. And if you're interested, cmspulse.org has some information on some states that did a pilot program using the community-based, like the Stanford DSMP model, and the outcomes that they achieved. And so our hope is that once they have these longitudinal outcomes over time, that they will actually consider going to the Office of Management and Budget to start reimbursing for these classes. But of course, they can't do that without the data behind it to show. So just letting everyone know that that's part of what we're working on. And if you're interested in helping us send that data into Medicare for, in the long term, justifying the benefit, I would absolutely be willing to work with you on that.
And what was the website you just mentioned, Meredith?
It's cmspulse.org.
Okay. PULIC.
Yes, and it can be found under Community Initiatives and Everybody with Diabetes Count.
Great.
Okay, thank you. That's it for me on the sustainability. Did anybody have any questions about or comments about the meeting, where we are with things, that kind of thing, with our sustainability effort with the consultant? That's what I mean.
I still thought it was great. I thought Wendy was wonderful, and it was great to have us all in one room.
I thought it was wonderful too. This is Monica, and it gave us so many ideas and hope, I guess, because sometimes we get let down. We're frustrated because things don't always work out, and it gave us, well, it gave me anyway, a lot of hope.
Hope is good. I'm glad to hear that.
A lot of ideas.
Yeah. Okay. Okay, great. And Wendy's writing up a meeting summary for me too, so I can send that out as a refresher for people who did go and for information for people who didn't. And our contract on that is due to wrap up actually the end of February, so if we're going to do I'll have to talk with Wendy about whether we can do a conference call or webinar before that date, and then I'll get with you all to do a poll and try to get a time that works for as many people as possible. And then we'll talk more about what's next on our next call.
Yeah, thank you. Thanks, Connie. All right, so we're going to move along. We have about 20 more minutes here. Centralized referral system update. Lindsay.
Hi, everybody. I just want to show you what we have going now. Hopefully you are going to see this on your screen. Let me know if you're seeing our Self-Management Colorado site on your webinar screen. Yay, there we are. Okay, there's our website. And now you will see, if you go to classes, you can do pull-down menu of the classes for the public. And now you can also do the leader training. And this is, we still are we're working on getting these in. What happens is, if you look for something that's a leader training, these are the leader trainings that are set up and in the system that are called Healthier Living Colorado, and then the description will tell you it's chronic disease. This is Greeley's training. I don't know if Whitney's on the phone with us, but this is the Weld County training under Weld County's license. So this will now show any leader training that you send us the information on. Now, the reason I want to show you this one is we don't have a lot of the details on this. And so we don't have details that we can put in. So as we did with the classes, we're going to ask, and I'll get back in touch with, actually Cheryl will probably get back in touch with Whitney, so we can get things like when and where and that kind of information, because we will need that in order to make this a real listing. But I wanted to show you what it's going to look like. We can also, we've got Tamondo in here, and as we get more classes, so this is the Tamondo control, shows you where it is, how to get registered, gives you a description of what it is, and it is printable. So we are now able to get that information up for you. So as you were telling us about leader classes, or as you know about them, if you would fill out the same paperwork that you do for a class that you send in, and Cheryl very nicely puts it up for us so that we have all these classes listed, it would be really helpful for us to get the same kind of information on all of the trainings. So if you haven't seen this, this is at selfmanagementcolorado.org, and we have all of the classes listed across the state, and they are by area, as you can see. And then when you click on the specific information, that's when you'll get what it's called and how to contact them, and et cetera, et cetera. So that is a big thing we got accomplished, so I am very happy to let you know. But again, the more details we have, the better. And what the system forces us to do is we have to have a date and we have to have a time. So it's going to be just like our other classes, that we're going to ask you and say we can't put it up until we have that information. But it's there, and hopefully that will help us all find each other's training.
This is great, Lindsay. So I'm looking at this. I went on to the site myself so I could see, but let me back up so everybody can see what I'm talking about. If you go to class, can you click on classes again? Is that where you go to get the, and then you go to leader training?
Yes.
Okay. So can
right
you click on that?
It says choose a leader training.
Right. Yeah.
And then what we're doing is, as we get the listings, we will add them in here. So, for example, we don't have a leader training yet for cancer, thriving, and surviving. It isn't in the system yet, but when it is in the system, it will show up as one of the options.
Right. And then when I clicked on leader training, the first, there's 2 Healthier Living Colorados in there. I think the second one is not, there's nothing there. But on the first one, if you click on that, and then the one for, are they all called, I notice they're using your name. Does that mean that
if it's under our license and it's a class that's a leader training in Healthier Living Colorado, that's how it shows up. If it's a leader training in Healthier Living, that's how Wells County shows it.
So whatever the name of the local organization uses is what you put up there? So it could be Be Well, it could be Live Well, it could be whatever. So this is just what we have, and this went live as of last night. So the only leader trainings I had that I knew about are the ones that are in there now. So the next time Monica has one, Monica, remind me what you call your program.
I'm sorry, repeat that again.
What do you call your program? Live Well, Healthier Living?
Well, we usually go Living Well With, and then whatever.
So then it would say leader training, Living Well with Chronic Conditions.
Yes.
So a couple of questions I had. One is just for you, Lindsay, for COA. If you might want to put where it has the cost for yours of $650, if you wanted to add some language that said limited number of partial scholarships are available or something like that, then maybe that might just keep people from just clicking off of it if they can't afford
that. We usually, and I do not know whether it's in here, usually what we have is under additional information.
Oh, I didn't scroll down far enough. I didn't see that.
And it says that there's financial assistance available, and
as long as people scroll down far enough, I didn't, so I wouldn't have seen that. But anyway, okay, that's good. Then the other thing I was just wondering about, not to bring up another sore spot, but I'm wondering if I'll have the same problem with people looking at that and not knowing what class, what training you're talking about because of all the different names.
Well, if you look in the description, what it will tell you is what it is, and that this is the evidence-based program from Stanford University. We can also, you know, what we need to do is work with how we need to track all of it internally, so that, because this is basically one piece of our database, so you know, we have some flexibility in how we're doing it, but we do not. So we've under, for example, the classes for the public, we have it all as, for example, chronic disease, and then when you look at each individual area, it will tell you what it's called in that area. The problem is with the training, it's set up a little bit differently, and that is the leader trainings, because we're assuming that the people that are going to the leader trainings have more of a connection to the community, so that they're not just looking at a class, they're looking for a specific training. So we can definitely take a look at that if we want to change it around. And I realize that right now that up here it's got the leader training showing up, and it shouldn't show up in that section. It should show up in the other section. So I still have some changes to do.
Yeah, I don't know what other people think. I like the way you've done it with the classes. I think that helps. I think, in my opinion, it would help as well for the leader training.
Okay.
People within our community, I mean, you just had to ask Monica what she calls her class, so I think, you know, none of us knows what everybody else calls it. So,
okay.
And you could still have your individual names that we have at this point on the specific descriptions for each class, but that's my opinion. I don't know if anybody else wants to weigh in on that.
I am happy to do that. I know we're short on time, so I want to turn it back over because I know we have other agenda items. But just for now, my message is for everybody: if you have a training, send it so we can get it in the system. And even if this is not yet the perfect way to list it, we want to at least get them up on the website so that we can all find them. So I am happy I'm happy to look at changing that around. And we'll get that on the list. But meantime, send us that info.
That's great, Lindsay, because otherwise, you know, I've wanted to think of what somebody mentioned in a conference call about classes or training coming up, and it's a little bit harder to go back and find that and, you know, which meeting it was discussed. So this is a great way to just be able to go to it and see it. So as long as everybody sends you their information as soon as possible, then that would be a great way to have a timely list. So thank you for doing that.
Sure. If you can scroll to the next slide, one more. Okay, here's what we have right now. So this is what we're showing. So this is the one we just saw, that's Greeley's. But as you can see, that only date and information we have is that it is in September of 2015. So in order for me to put it into our database, I had to connect it to not only a license holder but a site. So it's in there, but the information is not correct. So we're going to follow up with Whitney, and if we can't get the right information yet, we're going to take it down until we have the right information, because it won't do us any good to have it up there wrong. And then the only other trainings that I have in there now are the ones that are scheduled through COA, because we have the information on those. So we have a Tamondo, a chronic disease, a cancer, thriving and surviving, and the chronic pain, and the Tamondo with the diabetes cross training. But that's what we've got for the whole state. So when anybody has additional stuff, let us know. And we'll still do it on the webinars too, but.
All right. If there are any more questions, I'm going to ask Connie then and everyone follow up. We've got about 10 minutes just on the workshop titles. Would there be any follow-up discussion? Where are we at with that?
Well, I guess the meeting was really helpful, I think, in identifying what the preferences were for doing with the name. Overall, for those of you, anybody who wasn't at the meeting, we put up the different, I wrote up a bulleted list of all the different suggestions that were made on our previous conference call, and then we didn't have lots of time to talk about it. So our consultant had everybody put, green dots on the ones they really liked. And so the one idea that came to the top of had the most dots was to use the English version of the Spanish language classes, taking control of your health, taking control of your diabetes. And not everybody knows if they can do that. Some people said they need to talk to their directors, etc. And I haven't talked with Lindsay or Mary Pat since then, so it'd be kind of putting you on the spot. But the one I know that COA doesn't want to change its name, so we're kind of back to either, as far as I can see, we're either back to three things: leaving it as it is, which most people have said they don't want to do, or having two different names, such as the English version of the Tomondo classes for everybody out there, keeping its name and everybody else adopting this other name, or adopting COA's name and I've mentioned before that we'd need to know, or COA would need to decide, if you don't already know, if you are open to doing that, and if so, what the contingencies would be. I mean, what would that mean for you, and then what would it mean for the local license holders? So I don't know if that's something you have already, and you could either send out to people for consideration, or if you want to wait and see what's happening between you and AHAC as far as leading the future sustainability efforts, or what you would like to suggest. Lindsay, do you have some guidance on that?
Yeah, I think one of the questions is, clearly there was a lot of interest in a name that was not necessarily our name or anybody else's name, that we all used the same name. I'm not sure whether we all were voting on using exactly taking control of your health, or if what people were voting on was a name that was new to everybody. So I have some questions in my mind process-wise about that, and I also have a little question in my mind about if there's a way to come up with a name that we can use for everyone as a main name, and then still keep our own local identity. And that might be a way, because I don't think, just my own 2 cents, I'm not sure it makes any sense for anybody to have COA do one name and everybody else do another name. That seems like that's not good for either one of us. And so I think there's still some conversation that has to take place. And whether we do that as a group, or whether we all talk a little bit offline and then come up with a couple of things, and maybe we just come up with several different versions of what we want to do, write it out very detailed, talk about it, and then poll everybody. Because I think the dots was really a helpful exercise to kind of get a pulse of where everybody was. I'm not sure I feel comfortable going with that as the vote on what we want to do, if that makes sense. So I know we have a strategic planning session today and then a board meeting on Monday. So I'll know more about what our leadership and our board thinks about it next week.
Okay. Well, maybe what I could do is write up what I had at the meeting, and then also other names that people have, all the other names that we know of. I hadn't heard from anybody that they want something that nobody has used before, but I think the main thing I heard and from everybody else was that they wanted one for simplicity, and they didn't want to use chronic disease in the name. The negative connotation it has with consumers. So,
I'm with you on that one. Yeah, we'd be better off calling it Bob than chronic disease.
Yeah, Bob's class.
Yeah, I thought let's all vote on that. No. Yeah, and it's such a big decision that I think we just want to really ruminate over it. Yeah, ruminate is it. That's the word. Ruminate, as Mary Patrick said.
Well, I appreciate you thinking about the other options, and I want people to be as happy with the outcome as possible too. So I appreciate that. Maybe the first suggestion you mentioned would work, especially for you. That would allow you to keep your branding. I'm guessing other people may not want to do that, but everybody, I think we agreed that we needed to have something that identified chronic disease self-management program and Stanford and all that somewhere in the text for the medical community that identifies more with that language, which, but as long as it's not like the headline.
Yeah.
But
yeah.
I could write up some of those other names and then maybe do another email out to people, and I can touch base with you before doing that as well, Lindsay.
Yeah, and I liked the dot thing because it really gave you a real good visual of what we were all thinking. I just ruminate is the word. Yeah.
Well, and I think other organizations also responded they needed to check with their boards or supervisors or whatever. So I'm sure that all of that is just taking some time to sort of have those discussions.
Yeah, and maybe what we could do is just try to figure out is, the vast majority, I mean, that way more than half of people put the dot near that name. So we could, just make sure that is if you were to pick a name, is that the one that the largest number of people would pick, and then
and maybe even if you were going to pick a new name, which new name would it be, and have that be one of them, but maybe have some others in there too.
Yeah, that's what I meant. That's what I meant, Lindsay. I could give all the names, or hopefully we don't have to come up with a brand new one and start all over. But I guess that's a possibility. But all right, we'll do that. So don't have many minutes left, so I'll let you move on.
Goodness gracious. We are a talkative bunch, I'll tell you. So I know that Connie had shared an idea of a topic, and with the intent perhaps we would talk about it today. I feel like we're not going to give it adequate time, and these are both good topics. The first one, the HIPAA compliance, comes from a suggestion Melissa made at our group meeting, and I jotted it down, and she hoped maybe we could talk about it. And she, in fact, isn't on this call today anyway, but that could be a future agenda item, along with the whole conversation about participant retention. So my suggestion at this point, being 10:28 and respectful of the time, that we include those as topics for next month, if that would be doable. And then people would know that that would be a topic. I know we had some really good discussion today with Kelly and updates on the grant, and this still some follow-up on the sustainability and workshop titles. So if that's okay with everyone, I'd like to put those items on next month's agenda. And if there are any other suggestions.
Just if you could add health links as one. I think it's all strung together. Health links is one word, but anyway.
Oh, okay.
Maybe with a capital L. I could check on that. But anyway, that. And then CDSMP outcome data. We have some new information about some of that.
Oh, great. I kind of deduct that as we are getting closer and closer to the end of year 3, we'll have less time needed to discuss like the grant updates and some of that stuff that has been pertinent, and more time to do some of these other topics. So that'll be great.
Unless we
Anyone else have any other suggestions that would like to see the collaborative talk about in the next even couple, 3 months? All righty then. So
I'm
our
sure
last
I'll
slide,
have some, but Mary Pat, I think this is great. You put this on the end of the agenda, though, to get people thinking about what topics for next week. So thanks for doing that.
Sure. Sure. I think that gives us a good segue into next month and the next month and so forth. So our last slide is just a reminder of the next meeting. So I'm going to, since we had some success with me doing 1 month, my pilot project of sending you an Outlook, I'm going to this time do March, April, May, and June together. You'll get an Outlook invite for all 4 of those months, if that's all right. And July is separate because it's not going to be the first Thursday. It would be the second Thursday in July.
That's summer.
That sound good?
We're talking summer already.
I know.
Wow.
And then August, September, October, November would be a third one. So just so you know, you might be getting a few invites through Outlook to get those on your calendar.
Hey, Mary Pat, I have a question. Is it possible to put all the sign-in information and the links and all that in the calendar invite? Because I always have to go back through my email and find your
that's a really good question because I am still stumbling through that. So we did put a recurring invite into our go-to meetings. We just did that, and so it's showing all up. So now we have the exact same code, I think, correct? Where it was changing every month last year. So yes, I will do that. Good suggestion.
Thank you.
I'll put it right into the invite, and because it'll fly now for every month where it didn't before. So we're learning the system.
Great.
Great idea.
Thank you.
Yeah, it'll be more convenient. All righty, everybody. Any other final thoughts? Yay, it's getting warmer.
Yeah. And the webinar will be online.
Now your webinar will be online shortly, probably by later today. And we look forward to seeing you all again next month. All right, thank you, everyone. Bye-bye.
Thank you, Mary Pat. Bye-bye.